All right, I think we're gonna get started. Hello, everyone, and welcome to HCP's online webinar for this month titled All I Want for Christmas is HIPAA-Compliant Social Media. This is going to be a great presentation given by Nicole Stately, and I have the privilege of briefly introducing her today and reading her bio. Nicole Stately has spent the last 19 years in the healthcare management industry. She's been involved in a little bit of everything, including clearinghouse management, medical billing, coding, auditing, and compliance. She currently has certified professional certificates in compliance, medical auditing, and coding. She's passionate about helping organizations to not only be compliant, but to feel compliant and or feel supported in their compliance efforts. And with that, I will turn the time over to you, Nicole.
All right. Thank you, Josie. Thank you, everyone, for joining today. Now, I know that HIPAA compliant social media is on everyone's Christmas list, so hopefully I can provide you with the steps to make it happen. I'm going to jump right in. If you have any questions, you can put them in the Q&A, and then I will answer anything at the end of the presentation. All right, so for today's presentation, here are more or less the things that I'm going to be going over. I'm going to start out with the importance of HIPAA compliance, the importance of protecting patient privacy, common pitfalls that happen with current social media use, some steps for having HIPAA compliant social media practices. I will focus a lot on patient consent. You will get tired of hearing me say that. And then lastly, I will hopefully give you a social media strategy that you can start with in 2026. So first up is understanding the importance of HIPAA compliance. Whether you're using social media for marketing purposes, for professional use, or for personal use, HIPAA must be considered and followed. So all of you should already probably be aware of what HIPAA is, but just a quick recap so I make sure we're all on the same page. HIPAA is a federal law aiming to safeguard an individual's privacy in regards to their protected health information, otherwise known as PHI. PHI is any individually identifiable health information related to a person's past, present, or future physical or mental health treatment or payment. HIPAA regulations do apply to covered entities and business associates. There are no exceptions to that. Some examples of what a covered entity might be are healthcare providers, health plans, healthcare clearinghouses. Examples of business associates might be an RCM company, medical billing company, an auditing company, consultants, IT vendors, cloud service providers, EHR service providers, and so on. I'm assuming if you're on this presentation, you fall into one of those two categories, either as a covered entity or as a business associate. Everything that I talk about today will apply to both groups of people. So HIPAA compliance is essential. It's essential for healthcare organizations to safeguard patient privacy and health information. It is not optional. In light of this, special attention does need to be paid to marketing and communication activities. Whether that be on social media or not on social media, HIPAA should always be thought about. Everything should be put through that HIPAA eyeglass, and make sure that everything is up to par. Adhering to HIPAA helps us do several things: establish patient trust, avoid costly penalties, and grow your business. Social media can be a great tool for growing your business. Speaking of that, online sources such as social media are used for lots of different things. Two of the main ways that we see it, within the healthcare space is for marketing, and the other is for health engagement. You might already be using social media for several of these things, but some of the ways that we see social media being used is to communicate with the public about a product or service that you offer. You can also use social media to promote health events such as health fairs or community-based support groups. Many also use it to inform about government-sponsored programs such as Silver Sneakers or other Medicare benefits. Social media is being used more and more also to share patient success stories, which it can be great for that. A very common use is online business reviews. So, where a patient or a business partner can post a review about your organization and you can respond to these reviews, whether that be a Google review, it could be a Facebook review. There's lots of different avenues now that someone can publicly talk about your business, and then you can also publicly then respond to them. Another growing market that we've seen, I'd say especially since COVID, but maybe even before that, is using social media in a fun or educational way through short content posts. Those could promote your business. They could just be for fun. We're seeing that with TikToks, Instagram Reels. A lot of healthcare organizations are jumping on that bandwagon of using those short content avenues to promote the business, make people aware of different things. So, social media has been around for a while, but we are seeing a dramatic increase of usage within the healthcare space. Here are some current stats that are related to social media use in healthcare. So 98%, sorry, skipped one. Facebook is the leading social media platform. I don't know if that'll change. Social media platforms kind of come and go over the years. Facebook seems to be one that has kind of, you know, put some roots in and doesn't seem to be going anywhere. 90% of healthcare providers have a presence on Facebook. Instagram, they see healthcare companies posting at least 8 times per week. So that's more than once per day, possibly in a given week. Healthcare organizations are posting something on Instagram. 65% of healthcare professionals use social media for patient education, which again, that can be a great space to talk about different topics, different healthcare concerns that are out there. LinkedIn, that one's being used by 70% of medical professionals for networking and professional development. And then the last statistic that I have, and this one is crazy to me, but social media advertising spending in healthcare alone, so just think about this, just in healthcare, is projected to reach $3.14 billion by the end of this year. So that's just for 2025, and that is just social media advertising within the healthcare space. I didn't even look up the stat for what that looks like across all industries. I can't even imagine the amount of money that is being poured into social media advertising. So, if you're part of that statistic or not quite yet and you want to be, hopefully I will help you to learn how to do it correctly so that you don't have fines or you don't have issues with patient trust and all of that fun stuff. So again, given those stats, it is clear that healthcare organizations are using social media. So let's make sure that you're doing it correctly. Want to make sure we're avoiding all those HIPAA violations, which are happening a lot. Um, Here's the data that's at risk, right? Patient data, if you're putting it out there, it's going to be at risk. This is largely due to a lack of training and a lack of strong social media policies within an organization. A lot of the data that is being disclosed when it shouldn't be probably could have been avoided with even just those two things, but we will talk a little bit about that more later. The data at risk includes medical history, diagnosis, test results, medications, treatment plans, patient photos and videos, and possibly even billing information. Sometimes the data that is compromised is in the background or on a desk or was unintentional, but healthcare organizations must avoid inadvertent disclosures when conducting marketing and social media activities. So even if you've made let's say a TikTok video and you think, oh, I didn't share any PHI in the video, but if through that video someone left their computer screen on and in the background there's someone's chart, then you have disclosed PHI to the world, even if it was by accident. If you pay attention to nothing else in this webinar, please memorize this. It is absolutely prohibited to share PHI on social media platforms without written patient consent. If you need to screenshot this, hopefully Buddy the Elf will help you to remember it. He seems a little bit shocked, but it is true. You cannot share PHI on social media, whether it's on your professional, personal page, doesn't matter. You have to have written patient consent, which again, I'll go into more depth in just a minute. There are several risks to your organization if you have an inadvertent or unauthorized disclosure of PHI on social media. So even in like the example I gave, if it's by accident, it was just a screen in the background, you are at risk. The first risk is fines, right? They're costly. They're not cheap. We're not talking about $100 ticket, saying like, oops, you made a mistake, don't do it again. We're talking tens of thousands of dollars. I will discuss an example in a moment, but you can be fined for unauthorized use of PHI on social media. It is considered a HIPAA breach. Next to consider is possibly class action lawsuits or other litigation. Even if the OCR, which is the Office of Civil Rights, who conducts HIPAA breach investigations, even if they fine you, the individual can also bring a lawsuit against you and receive monies under some state laws. So there are some states that don't allow it. So if the organization has already been fined by OCR, they consider that, a closed investigation. But under some state laws, the individual could also directly sue you or bring some sort of lawsuit against you if that patient, can prove harm or damages resulting from the disclosure. That's usually the line of thinking that they take. If you expose PHI on social media without permission, you also risk damaging your reputation as an organization or even as a physician. The power of social media has shown that mistakes do not stay hidden for long. I think we've seen some other, maybe more HR related examples of that over this last year. And you think nobody's watching, everybody's watching, everybody has a phone. Once it's out there, it's out there. Videos can go viral so fast and really possibly hurt your organization. Lastly, patient trust is so important in the healthcare space. If you're a physician, provider, you know that, right? You know, if your patients don't trust you or they don't trust your organization, they're unlikely to return, and they possibly might not get the care that they need because they have a distrust of physicians or just the healthcare organization in general. Patients want to know that the information they share with you or that you store for them is kept safe and is not going to be blasted into the public sphere without their consent. An improper disclosure could lead to the patient, like I said, leaving your practice, looking for care elsewhere. They also could make their own social media post saying, what you did wrong and how you disclosed their information, which then there's a ripple effect of that would be so hard to even measure what that could look like. So now we're going to look at some recent enforcement actions and the common pitfalls that led to the unauthorized disclosure of PHI. Our first pitfall is responding inappropriately to online reviews left by patients. This example that I have here was a dental practice in North Carolina. They responded to a bad patient review. I believe it was on Google. The response left by the practice included the patient's name, condition, and treatment details. This resulted in a $50,000 fine. So online reviews really should be treated very carefully. This is an excellent example because in this case, this was one singular patient and the fine was $50,000. That is a huge amount of money for really a single disclosure. This goes to show how important this is and how the OCR will fine you if you disclose that PHI when you shouldn't. So normally the review, a lot of times online reviews might already have the patient's name, depending on if their username for whatever that is, Google is their actual name. It could be, a different type of username. So that information might already be there, but you should never add to that, right? If anything else needs to be discussed, which I'll talk about in a second, if you need to follow up with that patient, you should always take the conversation offline. Don't do any sort of messaging through any social media platform and definitely not on a public forum on that public page where everyone can see it. So as I mentioned, here's some tips. These are some takeaways for online reviews, how to treat those, how to handle those appropriately. In the marketing world, online reviews are very important for every type of business. That's not just healthcare, right? So a lot of businesses rely on those online reviews, and they want the reviews to be good, right? You want that 5 stars or whatever the top is. You don't want negative reviews. So the stat was actually really interesting. But over 80% of consumers say a business without a 4 star or plus star rating will result in them avoiding the organization. I will say for me personally, I do look at those. And if it's less than that 4 stars, I definitely pause and I'm like, I don't know. And then I start to read the reviews and I start to see, like, okay, what are people saying about this? If it's a 5 star review, I don't even necessarily look because I'm like, okay, if a lot of people are giving them 5 stars, then it's probably good. So knowing this, responding to online reviews may be an essential piece of your business growth. So here again are some helpful hints how you should respond. The first option is you could choose not to respond to an online review. That is a way to go about it. Depending on the review and what the content is of that review, that might be the appropriate action. However, everyone in the marketing world knows the risk of not responding could also look very negative. It could lead to another negative review, or it could deter a potential patient from visiting your practice if it gives the perception that you don't care about their reviews. You don't care if someone's had a bad experience. So the recommendation is respond to the reviews. So whenever possible, you should. It is good business practice, and when done well, looks positive for your organization, even if it was originally a bad review. When responding, do not confirm if the individual providing the review is a patient of your practice. Also, do not confirm any details about their visit to your practice. No details. Establish a positive tone with phrases such as, "We take comments like this seriously," or "We will be happy to help remedy this situation." Always thank the reviewer for their comment or feedback. And then if some additional information needs to happen, you need some follow up, you want to follow up with that patient, you should invite the individual to contact you directly to further discuss the situation offline. Don't do it in that public space unless you can do it without providing any details about the visit, which will probably prove difficult. And then, if necessary, you could reach out if you knew who that patient was based on their username. You could reach out to them individually, but again, offline. The next common pitfall is an inadvertent disclosure. So we kind of talked about this a little bit. But in this case, there was a pediatric ICU ER nurse at a Texas children's hospital. She was treating a child for a rare case of the measles. She posted about this patient in a Facebook group that discussed vaccinations. She detailed the patient's condition and suffering. The nurse did not include the patient's name. However, her Facebook profile included her place of employment. This allowed users to narrow down the potential patient, and due to the fact that measles rates are so low, it was possible that someone could have figured out who the patient was. In this case, the nurse was fired for violating the HIPAA privacy rule. The nurse may have thought she was in the clear, right, since she didn't use the patient's name, but she still gave too many details, and her profile contained specifics that put the patient's PHI at risk. So you must avoid sharing details about a patient, even if the information is considered de-identified, meaning that it is not clear, maybe in the post or comment, who the patient is. But the idea is that if someone could reasonably connect the dots, right, which especially nowadays, there's so much information out there. If they can reasonably put all those dots together and figure out who the patient is, the sharing of this information should be avoided without authorization, of course. Our next pitfall is sharing patient success stories or testimonials without the patient's permission. So in this case, there was a rehabilitation and long-term care facility that launched a success story marketing campaign that involved the success stories of approximately 150 patients. Now, again, success stories, that's great. That's a great marketing tool. On their website and social media platforms, they posted patient names, photos, condition, and treatment details, as well as their recovery information. All of this was done without the patient's authorization. The facility was fined $182,000 for the unauthorized disclosure of PHI. This is a prime example of well-intentioned marketing, right? Like I said, great idea, great campaign. You want to share those success stories. A lot of times those bring hope and healing to other people out there who might have a similar condition or who are looking for alternate treatment options. And then they come across, success stories that you had at your clinic. It's a great idea, but you have to do it correctly. You have to get that written authorization, which again we'll talk about later. um, this to me is a sad cautionary tale because it could have been avoided. So this is some tips for doing patient success stories well. Um, First up, I'm going to sound like a broken record today, but you need to obtain written patient consent. Next, your social media posts should only contain the minimum necessary PHI. Do not add unnecessary health information. You should only share what was authorized by the patient. We'll talk more about this. I'm going to talk specifically about that written authorization and what it should include. But it's very important that patients know exactly what will be shared. Um, but you should also encourage patients to share positive experiences. So whether it is a patient success story or maybe, they had a good experience in your office and you tell them like, hey, don't forget to review us on Google. In that case, if they're going on to Google and they're sharing that review, even though you've encouraged them to do that, you don't necessarily need written authorization because you're not the one posting it. But just getting in that rhythm of when something positive happens, you do want your patients to share that, right? Or even your business vendors, partners that you work with. Um, Word of mouth is a powerful thing as well. And that's happening mostly on social media these days. So yeah, don't be afraid to use this marketing tool simply due to the regulations. You can do it compliantly, and it can have a huge positive impact on your business and patients. And then lastly, be sure that patients know that once something is posted on social media, it is almost impossible to completely delete. I think we've all learned that or seen that. We've seen many cautionary tales where somebody posts something and then they quickly take it down. Let's say even, government officials or, business leaders, CEOs of companies who post something and then they're like, oh no, I shouldn't have posted that, and they quickly take it down. But even if it's on social media for a split second, someone has screenshotted it, someone has shared it, it's out there. So even if a patient, gives their consent, make sure that they know, hey, once I post this, it's going to be tricky for us to completely unpost it. It might still have some sort of footprint that's possibly lasting forever. Our next pitfall is sharing patient PHI without consent. So this one looks a little bit differently than some of the other ones, but a nurse at a Jackson Memorial Hospital posted photos on her personal Facebook profile of an infant with a rare birth defect. She was the infant's NICU nurse and added a comment to the photo that stated, "My night was going great, then boom." The nurse did not obtain authorization to post the infant's photo or to discuss their condition. That nurse was terminated. It's important to note that if a violation is not reported to OCR or only involved one patient, it's possible they will not investigate it, but that it's handled internally. So in this case, the hospital did handle this internally. The parents of the infant, chose not to report it to OCR. If it would have been reported to OCR, it's very possible that it would have been investigated and the hospital would have received a fine. In this case, they did handle it internally, but that did result in a termination. Um, yeah, more often than not, it does lead to the termination of an employee, which can be a bummer because you can have a really great employee, a really great nurse, a great physician, great staff, and they make this mistake that could potentially be huge for your organization, and that means they have to leave. And you don't want to lose good people based on something that if you just had the right policies and procedures in place that it could have been avoided. Um, what's also difficult to measure in these situations is the loss of reputation for the healthcare organizations, right? So if people are seeing that, like, oh, nurses can just post your photos, on social media without your consent, that doesn't look good for the operations of your facility, clinic, business. Patients again can lose trust, and will probably avoid these organizations, especially, all these examples I'm giving you, these all made headlines. So these aren't things that were just, in the local news. These were things that were out there. Now that hospitals on everyone's radar as possibly having maybe some loose policies and procedures around patient privacy. And it's not a good look. The last pitfall that we'll discuss today, and I'm sure there's more that I missed, but I tried to focus on the ones that um, I see more often than not. But this last one is a tricky one. This is the blurred lines between personal and professional use on social media and the acceptable conduct on those platforms. So, if you're on social media at all, which I'm assuming most of us are, you probably heard about this next incident. This one actually happened in September of this year. There were nearly a dozen staff members at a clinic who were fired due to a viral TikTok video. The video showed clinical staff mocking the bodily fluids that are left by patients on exam tables. This one was heavily in the news, so if you missed it, I don't know how you missed it because I saw it on pretty much every platform that I'm on. Um, this one's, another bummer to me. What might have started as an innocent video posted on a personal account led to questions about the nurse's, professional conduct and violations of patient privacy, really. Again, this video made national news and it's a cautionary tale. In this case, no obvious patient data was used, but it did violate patient trust and dignity, as well as being unprofessional and disrespectful. Again, in this case, there were no OCR fines. The OCR did not investigate this. It probably was not even reported because it was handled internally. But making national headlines for unprofessionalism and violating patient privacy is never going to be good for your organization. Again, it's so hard to get the metrics on the loss of revenue or potential just loss of patient trust, but you don't want to make national headlines. I can tell you that for sure. So the OCR, which again is the Office of Civil Rights, and they conduct all of the investigations in HIPAA breaches, they have been very clear about this. So the former OCR director, Melanie Fontes Rayner, she stated, quote, OCR continues to receive complaints about healthcare providers disclosing their patients' protected health information on social media or the internet. Simply put, this is not allowed. The HIPAA privacy rule expressly protects patients from this type of activity, which violates both patient trust and law. OCR will investigate and take action against such impermissible disclosures, no matter how large or small the organization. So, again, as a reminder, HIPAA breaches are investigated no matter the size of the organization. A single physician practice can be investigated and fined just as easily as a large hospital. Also, as a reminder, and I said it at the beginning, but I'll say it again, this does apply to business associates as well. If you handle PHI in any way and you fall under HIPAA regulations, you have to consider these things. So now that we've explored the importance of HIPAA compliance on social media and the common pitfalls, let's look at some best practices, right? Now that we know all that information, like, okay, what do we do? Um, these are going to be best practices for social media use, whether that be for marketing, education, or professional or personal use. These are the basic social media best practices. There's probably more, again, but I tried to focus on kind of the main areas that you 100% should have in place. I will go into detail about each of these, but this is the best practices. Developing or revising a social media policy. Next is obtaining patient authorization before any social media or online use of PHI. Avoiding communication that involves PHI via non-secure platforms, which I'll talk about those. Keeping professional and personal social media use separate. This one gets super tricky. And then lastly, developing a process and procedure for monitoring and auditing social media use. If you're a compliance officer on this call, that will probably fall under your bucket. If you don't have a compliance officer in your organization, you got to figure out someone who can champion this for your team. All right, social media policy. This is super important. If you don't currently have a social media policy, you need to create one. Similar to AI, it's just something that's just out there, right? Everybody is using it. There's really very rare exceptions where there's somebody who hasn't used social media, isn't using it. So you need to create a policy, even if you're not currently using social media for marketing, right? So let's say you're like, we don't even use it for marketing. We don't need this. All of your staff probably uses social media and they need to know the boundaries of what they can and cannot post on their personal accounts, right? So here's what your policy should have in a nutshell. It should make very clear what employees can and cannot do on social media as it pertains to patients or your organization's business operations. The policy needs to explain the requirements for patient written authorization before any PHI or even any de-identified patient information is shared on social media. Again, we saw that with the TikTok video and the nurses. There wasn't even really any patient information in that video, but it still was a huge problem. Next, you need to outline the procedure for obtaining a patient authorization. That should be clearly outlined. You should have a statement regarding compliance with HIPAA and the FTC Act. I don't really go into the FTC Act today. That's kind of its whole other thing. But you also need to be in compliance with that for any, marketing, any really social media posts that you put out there. The policy should define the different types of content that are permitted, such as educational posts, health tips, success stories, fun videos, etc. Again, it's creating those boundaries for your organization on what is allowed and what is not allowed. It is best practice to require employees to receive approval from a supervisor before anything work-related or related to patients is posted on social media. This includes personal accounts. Now, again, as an organization, you can kind of decide what to do with that. But what we've seen with a lot of breaches, investigations, things out there is a lot of times this is happening through human error. So best practice might just be to make sure that everyone clears a post that they're going to make that is related to work. Again, the purpose of this is to ensure that all regulations and requirements are being followed. You don't want to, number one, have a fine, as we talked about, and I almost guarantee you that that staff person does not want to lose their job over a social media post. You should also have a section regarding personal social media use. You'll want to decide if you allow employees to send or receive friend requests for patients or even business partners. I will say best practice is to not allow staff to be social media friends with patients. This one actually interestingly came up in a call I had with a client today because she was saying we were going over her social media policy and she was saying, hey, we live in a small town. My kids go to school with kids of patients that come to our practice. Like, how does that work? I think that the biggest thing with that, the biggest thing with staff being friends with patients on Facebook in that sort of scenario where you're in a small town, a small community where everyone knows everyone, is that you need to have the boundaries so clear. Letting your staff know they can never discuss work, diagnosis, treatment, even mentioning, in a comment on a Facebook post, hey, it was great to see you at the clinic today. Nope, there needs to be clear boundaries between your work life and your personal life. So, yes, maybe they can be friends on Facebook, but they need to know what those boundaries are because all it takes is one person, one patient who maybe your staff thinks you're really good friends with, or maybe you are, but them feeling uncomfortable with the fact that you just disclosed to people on social media that they, are a patient at your practice, at your clinic, anything like that. So if you're going to allow it, make sure there are clear boundaries for what that should look like. The next thing that your social media policy should have is guidelines for responding to patients who reach out on social media, whether that's through an online review or a private message. Let's say you have a staff person or even a physician who receives a message from a patient through Facebook. How do you want everyone to handle that? Best practice would be to move that conversation to a secure platform. Don't even use messaging on those platforms. Lastly, the policy needs to outline how to report non-compliance. So that's your staff is clear, physicians are clear, everyone is clear. If they see something that looks like it does not fit in line with this policy or HIPAA, they should report it. All right. The next best practice is actually a requirement. This is not optional. Before PHI or any information related to a patient is disclosed online, written patient authorization should be obtained. The authorization should include the following. Again, it could include more of this, but these are the bones, at least, of what should be there. First off, common sense, but just wanted to make sure it's on there, is the patient's full name and the name of the organization or practice that plans to use their information. Next up is a description of what content will be used. Be very specific on this. For example, do you plan on using the patient's name, photos, diagnosis, treatment specifics? The patient should know exactly what they're authorizing, right? If you just say, hey, we want to use, your success story on social media. Okay, great. Now you post that and it has pictures of their x-rays and pictures of their face. The patient could say, oh my gosh, I didn't know you were going to put all of that out there. I thought you were just going to write up like a little success story thing. So you don't ever want to catch patients off guard. You want to be very clear with them on what content, what PHI you're going to be using in the content. The type of disclosure should be included. So will that information again be used for a success story series, marketing materials, educational materials? Be very clear. Next, which platforms? Do you plan on just putting it on one platform, but then also letting the patient know that there's always a lot of times can be cross posting. That might come down to more your security measures on your social media posts. Like, are you going to allow those things to be shared, or can you turn off the share button? That's kind of a whole different thing to chat about. Could probably do a whole webinar on this, the security metrics behind it. But make sure that the patient knows at least the intention of which platforms you are going to be putting the information on. Next is the authorization should contain a disclaimer about the possible loss of content control. So I kind of already talked about that. I also talked about this earlier. We all know once something is posted online, it is almost impossible to fully erase it. The patient needs to understand this. Next, is there a particular length of time that the content will be uploaded? Consider also the real possibility that it could be forever. Like I said, it might be impossible to fully delete it. The patient needs to know that. The patient does have the right to revoke an authorization in writing, but the revocation will only apply to future use of their PHI. Part of that, again, is because once it's out there, it's so hard to get back. So the patient needs to know if you decide you don't want this authorization in place anymore, just know we won't post anything in the future, but we can't completely control what was already posted. Lastly, common sense, but the patient or legal guardian needs to sign it and it needs to be dated. The next thing to keep in mind is that no communication with a patient should be made through social media platforms. Why is this? This is because social media platforms will not sign a BA with you. So there are messaging, mechanisms that are built into Instagram, Facebook, LinkedIn, all of that. all of that data that you're putting in there, even though it's not public facing, is still at risk because LinkedIn, Instagram, Facebook, they have no requirements to follow HIPAA. They're not a business associate. They're not going to sign one. So that is why any communication with patients that includes PHI needs to not happen through those messaging tools. If someone reaches out, give them an alternate platform, an alternate email, something, some other way that they can contact you. The next practice is a tricky one for most organizations. What are the boundaries between professional social media use and personal social media use? Can an organization dictate what someone posts on their personal social media account? This has come up, I feel like, a lot in recent years where businesses are having to decide, can we control that? Do we want to control that? Do we trust our employees to, remain professional out there on their personal accounts? Do they have to be professional? There's a lot of questions. As an organization, you need to decide what those guidelines will be. You can create a policy that employee knows if they're employed by your organization that these are what the expectations are. What is clear is that no matter whose account it is on, whether it's personal, professional, patient consent must be obtained before disclosing PHI. Best practices include always being aware of your audience and maintaining professionalism, right? So best practices include, again, not becoming friends with patients on your personal profile. If you're a physician, I recommend having a professional profile that is more appropriate for things like education, health tips. That, you could have your patients be friends with you on that platform or on that profile because that's a professional profile, not a personal one. Again, providing clear guidelines for your organization is essential. Again, we have seen how those lines have been blurred, how people have lost their jobs over posts that they made on their personal social media, not thinking anything of it or thinking that they could. And then the organization, whether it's a healthcare organization or any other industry, have fired those employees for what they posted. Finally, is establishing a process and procedure for monitoring and auditing. This is just as important as creating the policy, right? So you can create a policy, but if you're not following up with that policy to make sure that people are actually following it, then it's like you don't have one. Social media accounts, especially the organization ones, should be analyzed and watched for non-compliance. Employees should also be aware of who to contact, again, if they see non-compliance with your policies and procedures around social media. They should know how to report it. That should be very clear. Um, Again, broken record here, but I've already mentioned this several times. Patient consent is absolutely necessary. And here are some additional things to keep in mind, just as a reminder. There are a lot of questions out there about whether a patient story or case can be shared on social media without consent if all of their personal identifiers are removed from the story. Technically, it may be possible, but it is strongly discouraged. Social media is its own ecosystem, and people have ways of finding out who someone is talking about, even if no personal identifiers are used. It's actually kind of amazes me how quickly people can figure out who someone else is talking about. Best practice is not to share anything about a patient online without their written consent. It does not matter if the information is shared on a professional account or a personal account. HIPAA regulations must be followed and patient consent obtained. There are a lot of health influencers out there who are actually treading that line constantly of HIPAA violations with their content. Some of them, I'm actually amazed they still have a job. I don't know if they've been found out yet, and maybe that's what it is. I do think some are doing it okay where they're keeping things general enough, but again, they're always going to have that risk if someone can figure out who that story is about and that person, that individual finds out, they could complain, right? They could go straight to the organization, they could go straight to OCR and say that their information has been breached. Remember that even if you get patient consent to share the PHI online, the minimum necessary standard should still be followed. So don't overshare. For example, their last name probably isn't ever needed to be shared. You might not even need to share their first name. Don't include what doesn't add to the story. Avoid details about their condition that aren't relevant, and possibly avoid pictures if they're not needed. Maybe you're showing a picture of what the actual issue was, but maybe one that's not of their face. Again, if the patient consents to it, it's fine, but always keep that minimum necessary standard in mind. All right, now we're going to take a quick look at social media strategy to kick things off correctly in 2026. So, whether you already have a social media policy and procedure in place, or if you have absolutely nothing, here are some action items to consider. First up, analyze your current risk. This is, a big thing in compliance. We say this about pretty much everything. You should always be analyzing your risk, your moment in time with what you have right now. What are your risks? What social media is your organization already using? Is it being used correctly? Are employees using your organization or patients to make content? Do you know that they're doing this? Are you aware of this? Do you even know, again, yeah, is this even currently happening? Have you looked into it at all? You then kind of take that, you assess what the risks are to your organization, and that helps you to establish that baseline and to start mitigating any of those, especially higher risk areas. This can also help if you do already have a social media policy, but maybe it's not great, needs to be updated, it's not working. Analyzing your current risk will help you to develop all these things. Next up, develop a social media policy if you don't already have one. If you do, maybe go back and review the suggestions that I made, or look out there to see what social media policies exist to make sure that yours lines up, right? It should align with HIPAA and FTC guidelines. Next, train all employees, anyone who's involved with patients, PHI, or who could be at some point, should receive training on your social media policy and procedures. Don't forget about people in sales and marketing. This team is often overlooked for training because their job usually doesn't, directly involve handling PHI. So a lot of times people think like, oh, they don't need to be trained on these things. They're not even handling PHI. But all members of your organization should receive annual training. They might have, disclosures to PHI that you're not even thinking of. Next, you need to develop a patient authorization form. You may already be thinking, wait, I already have a HIPAA authorization form. Doesn't that cover this? No, it does not. You need to have a specific one, I would say for social media use. Now, it might be more a marketing authorization, and social media, is a piece of it. Again, the more specific, the better. If you have a social media one, then you're covering all of your bases. You don't want your patients to be caught off guard, or your other, business partners. Um, if they see, that their um, information is, being posted and it wasn't totally clear, they're going to be upset. Next up is ongoing auditing and monitoring. Again, I already discussed this, but be sure someone is in charge of this. Add this to someone's job description, right? Making sure that any non-compliance is investigated and mitigated properly. Again, social media does lead to HIPAA breaches and violations, so it should be treated with as much care as anything else that could expose PHI that shouldn't be. Lastly, use social media. I don't want you to be afraid to use it. There are obviously rules and regulations, but as I always like to tell people, in this industry is, hey, we all chose to work in the healthcare industry. It is a highly regulated industry, and we just have to follow the rules. But a lot can be done. It can be a great place to educate the public, promote your organization. There are many organizations out there who are doing it well. We actually have a client, one of our clients, they use TikTok. And all of us staff looked at it like a couple of weeks ago, and it was great. It was hilarious. They had funny posts, and they were doing it in a compliant way. If you want to check them out, their account name is Triangle sinus center. So triangle like the shape, sinus center, all one word. You'll see in their videos that it looks like they've thought of everything, right? Their videos have the computer screens are always off. Any papers on their desk are always turned over. I've even noticed that their cell phones are always turned upside down, even their personal cell phones, so that there's no identifying even of their personal information. There are no patients in the background because I looked, I was like, oh, I wonder if I'm going to catch, just even like the glimpse of a patient in the background. There was nothing. I looked through a bunch of videos because they're all that short content. I didn't see one thing that I would have considered a HIPAA violation. And it was just fun, right? The doctor was involved, the nurses were involved. Um, it appears this account, they're using it for mostly fun, but that's a marketing tool, right? Especially in this day and age. Occasionally they had some educational elements on it. I did see one patient success story, so that was great. But again, this is one example. There are plenty out there who are using social media correctly. I do believe it's possible with having a good policy and procedure and training your staff in place, then the social media world is open to you and you should definitely be using it. All right, that was a ton of information. So now I do want to pause for a moment, open it up to any questions. Josie, I don't know if we had anything pop up in the Q&A. Um,
Yes, we did. Do you want me to read through them?
sure, yeah, go for it.
Perfect. So the first one said, how would you handle a situation where a patient provides their own PHI in a review?
Yeah, that's a great question. I would say, obviously they are supplying that information. I would still err on the side of not confirming any of the information that they included in that review. I would always suggest taking any details or comments about any of their PHI offline.
Awesome. The next one said, I have seen an auto-generated response setup where the response is, we're sorry you hadn't that experience. Please call dot dot dot. Does that cross the does that cross the line?
The confirmation line. I
Yeah.
don't think so. I think that is probably fine because you're acknowledging that they had a bad experience, but you're not really discussing any of the details for it. And especially in that case where it's an obvious auto generated and then it provides that phone number to call, I think that that would be all right.
Awesome. The next one is, can an office republish Google review with names slash without names?
Oh, redacted information.
Redacted. Yep.
Okay, I
Yes.
see that on there. I would say no. Again, if you republish that Google review and you haven't asked the patient permission to post it on something else like Instagram, Facebook, you do still run the risk of, although again, they've provided the information in that Google review space, they did not give you permission to then reuse that review in a different platform. Um, I would get permission. I would say, hey, we saw your Google review. Do you mind if we repost that? I would have them sign something that says, yes, I'm totally fine with that. And then proceed that way.
Awesome.
Um,
I think the next one, she said you answered it. So, or said you answered it.
oh, okay. Awesome. And then, oh, looks like I do see. What if a patient posts a positive review on a public platform? Oh, okay. Oh, I see. It was like around the same time. Even if it's a, let's see, is it okay for the practice to then copy that review with the patient's viewable information from the original platform onto other ones, even if it's just the first name, last initial? Again, I think there's just too much room for error there. There's too many questions, and I would always err on the side of get the authorization because then you know for sure you're in the clear. The patient is aware of exactly what you're going to be using that post for, whether it is a Google review. Um, that may feel like overkill, but you don't want to end up with that patient upset that you have posted that. Even if it doesn't have their name on it, it's just better just to get that authorization.
Perfect. And then I also saw Another one that just asked to please repeat the social media. That was a good example that you were explaining the videos they made on TikTok.
Oh, what the name of the
I think the account name, yeah.
practice? Yeah, so it was, and I have to go back because it's triangle sinus. Let's see, I have it down here. Can't remember the last part. Triangle Sinus Center. So it was all one word, and I can put it in the chat actually,
Be
and then
great.
everyone will have it. But yeah, they're fun again, funny videos. But I think it's a great way. It's a great way also to get your staff involved. I mean, I think most people, social media has its positives and negatives for sure. But I think it can be used in a good way. So all right, I put that in the chat. So that was on TikTok. I didn't look to see if they were on any other social media platforms. They might cross, posts, which I think is what a lot of people do these days. But that is a good example of how to do it correctly. All right. Anything else popping up there, Josie?
Oh, we just got one more. How
Okay.
would you recommend an employer audit employees' social media use?
Yeah, so that one can be tricky. You might not be able to, right? I know, for example, my well, I guess all my social media besides maybe LinkedIn, I have it set to private. Nobody can look at my account. And you might have people who have that. So really, you're just doing that to the best of your ability. That might be something that is part of your policy, that you might need to put in there, or something that people are made aware of at hire, that is something that is audited from time to time. I don't know that you need to be too crazy with it unless you think that someone is posting things on social media that they either shouldn't be, or if they have some sort of influencer account where maybe they talk about work or they talk about health related things. But yeah, that one can get tricky just because you might not, if they don't have their profile public, you can't really look at it. If you can, I might just pop in there periodically and just make sure that they're not posting anything that they shouldn't be. That was a good question because that gets a little tricky.
All right, I think that was all the questions that I'm seeing.
All right. It looks like in the chat someone said, "Is this webinar recording going to be available to help with training?" Josie, I know you'll send it out, correct?
Yeah, I will send it out in an email and get the slides and the recordings to you.
Perfect. All right. I can stay on for a couple more minutes if anyone has any further questions, thoughts. I hope I made your Christmas wish list come true and that you now know how to have HIPAA compliant social media.